If you are someone who is considering BPT after that re-NEET, then this is your last opportunity to call yourself a doctor without giving that one exam, and this video is a must watch for you. Hi everyone, welcome or welcome back to my YouTube channel. My name is Navya and I am a BPT student. This is the most requested video on my Instagram, that is BPT Worth It in 2026. So here I am answering all your doubts in your head. Today I'll be talking about the course structure, the scope, the salary, the higher studies, the abroad opportunities, and the biggest question, that who should choose BPT and who absolutely shouldn't. And trust me, by the end of this video, you will be able to decide yourself if BPT is the right option for you or not. So let's not waste any further time and get into the video. BPT stands for Bachelors of Physiotherapy. Physiotherapists help patients to recover from injuries, the surgeries, the neurological conditions, and their movement related problems through their exercises, manual therapy, and rehabilitation techniques. The course duration is generally 4 years of theory and 6 months of compulsory internship, making it around 4.5 years in total. But if you are someone who is starting next year, that is in 2027, then this whole thing might convert into a 5-year degree program, which is 4 years of theory and 1 year of compulsory internship. During the internships, you will get the hands on clinical exposure in hospitals and in rehabilitation centers. Okay, so this is my favorite part of physiotherapy. So some of the major subjects that we study are anatomy, physiology, biochemistry, biomechanics. Then we have exercise therapy, electrotherapy, orthopedics, neurology, cardiorespiratory physiology, psychopsyche, and many more subjects. If you enjoy biology and learning about the human body, then this is something you will genuinely love. Demand of physiotherapy is rapidly increasing due to rising lifestyle disorders, sport injuries, post surgery rehabilitation needs, and an aging population. You can work in hospitals, sport clinics, fitness facilities, rehabilitation centers, or even set up your own private clinic in future. Now comes the most important and the most requested part of this video, which is salary. So let's talk reality. Freshers usually start with the modest salary, which is around 15,000 per month to just 30,000 per month, depending on your skills, your locations, and your workplace. However, with your experience, your specialization, and your private practice, your earnings will increase significantly. ऐसे समझते हैं कि अगर तुम किसी एक पेशेंट से 700 रुपये ले रहे हो एक सिटिंग के, एंड वो आपसे महीने में 10 सिटिंग्स ले रहा है, तो आपको एक पेशेंट से 7,000 रुपीज मिल रहा है. एंड इवन इफ यू हैव जस्ट 10 patients in a month, you are already at 70,000. And that's just not it. In cities like Delhi, Mumbai, Pune, Bangalore, physiotherapists charge around 1,000 to 1,200 rupees for one sitting. So you can just imagine everything accordingly. So yeah, we can say that it's not bad. It just grows steadily with your experience. अपॉर्चुनिटीज़ की कमी तो देखो बिल्कुल भी नहीं है गाइस इस फील्ड में. सो इफ़ यू आर समवन हु हैज़ डन देयर बैचलर्स, so try to go for masters in physiotherapy and specialize in fields like neurology, orthopedics, sports physiotherapy, cardiopulmonary physiotherapy, or even pediatrics. And if you are someone जिसे clinical exposure में interest नहीं है, then you can try to explore research path, the teaching path, healthcare management, and even the opportunities in abroad. Let's look at the positive side of the story first. So it has a very good patient interaction. It is a very meaningful healthcare career which is growing in demand right now. And it also gives us opportunity to work in sports and rehabilitation. And the best part, it gives us the possibility to open our own clinic in future. Now let's talk about the sad side of the physiotherapy. So the starting salary may be lower than what students expect initially, and the career growth totally depends upon your practical skills, your networking, and your continuous learning. So if you are someone who is going to choose this, please don't forget to keep yourself academically and practically skilled. Also, while studying, do not forget to keep yourself physically fit, because honestly this job can be really physically demanding. Choose BPT if you genuinely like healthcare, biology, patient care, and rehabilitation. Please don't choose it just because your MBBS didn't work out. Every healthcare field requires genuine interest to build a successful career. एंड या बीपीटी को एक लाइट कोर्स समझ के लेने की गलती बिल्कुल भी मत करना. इट इज़ नॉट अ लाइट कोर्स, इट इज़ genuinely demanding. You still have to study huge subjects and go on same hectic clinical postings just like MBBS students. So if someone asks me, is BPT worth it in 2026? My answer would be yes, but only if your expectations are realistic and you are genuinely interested in rehabilitation and patient care. I hope I was able to clear all your doubts in your head. If you still have further doubts, you can drop it in the comment section. I will try to make a separate Q&A video on that. Don't forget to subscribe the channel, hit the bell button and like the video for more such updates. Till then,